Okay, this is a quick video of how to orient a scan for a patient who's in for a specific problem. So this patient came in, he had pain in the upper anterior, and we took our 10 by 10 scan and we're taking a look to determine what we think's going on. So we're on just in the basic Explorer view here. One thing I'll do is just take a look on the lower right here, just on the kind of reconstruction file. And on this one, this particular case, I can see on the upper left, it looks like there's infection around tooth number 10. Now, upon examination, we take an intraoral photograph. We could see there was some swelling in the buccal vestibule here. And so it seems like that's the problem. So what we do is just grab the slider here, and you can watch as you slide. This is the axial view. You can see that blue line, the axial view, go up, and then we're going to left click and drag. And so this is on the patient's left. So we're going to put number 10 right. I call it in the bullseye, where the sagittal, you see in red, sagittal and coronal views come together. Then I'm going to hold the right mouse button down and rotate. And my goal being, I want the lines of these planes. So I'm going to left click and drag over. So the goal is I want the lines of the planes to be in the canal of the tooth. So I'm going to right click and rotate here, left click and slide it over. And then over here on the sagittal view, I'm going to left click, drag it over. And so in this case, once we're in the sagittal plane, we are in the coronal plane here, and then on the lower left here, you can see it looks like a bullseye straight down the canal of the tooth. Now, what we can do from here, we can get a nice view of the lesion on the upper right there, and then if we want, we can slide in and out on the coronal view if we want to see it in that view. But I am certainly satisfied to just have this view for now, and then have these lines, everything to be in the canal. If you're working with a molar, if it's like number 14, you just look and either center it in the tooth, or we may get into the, make these lines go down the palatal root, if that's where the abscess is, or the radiolucency is. So that's just a quick overview of our goal as far as aligning the scan, to find a trouble spot. I'll try to do some more examples, so you can see those. In this case, if we were going to do root canal therapy, what we'd like to do is just go over to annotation, select measure length, go to the apex, and then on this tooth it has a full metal crown. So, well, really any anterior tooth we're going to measure to the incisal edge. So it's right at 22. And on this case, we actually started the root canal treatment today. It was right at 21, 22 millimeters. So what that does is helps us select the files that we're going to use for treatment, and just have an idea of where we are as we're working our way down the canal. I hope you found this helpful. I'll try and make more videos to help make things more clear as far as how to use Romexis in everyday practice. Thank you.